So let's maybe get started. This evening, we're going to chat a little bit about male pelvic health. As I'm sure a few of you know, it's Movember, so hopefully some of you have got some nice mustaches going this month to celebrate Men's Health Month and kind of awareness around men's health. I am Ashlea Masters. I work at Aramosa Physio through our Bullfrog location in Guelph and have been here for a couple of years now, and have taken on our male pelvic health associate model back in January from my colleague Michelle, who some of you may have known from some of our previous webinars. And so it's kind of my role to go through and do some education amongst our staff members, as well as our patients and general public, to kind of raise awareness around men's health and pelvic health specifically. I am a registered physiotherapist, both orthopedic physio as well as pelvic health physiotherapy, and so treat both within our clinic here. Certainly at any time, if anybody has any questions, feel free to pop it in the chat, and I can always get back to you throughout if possible, and certainly we'll have a question and answer period at the end of our presentation today. So a little bit of an overview around what we're going to chat about this evening is certainly just some education on men's health kind of awareness. Obviously, this month is a big deal for that. And so a few statistics and education around, men's health in general. We're also going to talk about some male pelvic anatomy, what physiotherapy assessment and treatment looks like for our male pelvic demographic. A few conditions that we'll touch on as well is prostate cancer and radical prostatectomy, and certain treatments that patients might find are available to them if that's a condition they're dealing with. Additionally, we'll talk about some pelvic and lumbopelvic pain, chronic prostatitis, pain type conditions within the pelvic region, as well as something called coccydynia, which just means tailbone pain. Last, we'll talk a little bit around some bladder conditions and sexual dysfunction, so erectile dysfunction, and some things that physiotherapy can do to help patients experiencing these types of symptoms and conditions. And we'll touch a little bit on exercise and typically what we would give patients for any sort of pelvic health condition, kind of where we start with stuff like that. Okay. So a little bit of information around men's health and men's health awareness. As I mentioned at the start of the presentation, this month is Men's Health Month, known as Movember. Put the little mustache there for fun, obviously. Hopefully some of you've got your stash going on this month. A few statistics that are worth noting around, men's health and pelvic dysfunction in particular. It's quite interesting because there's certainly a gap, I think, in our healthcare system around providing pelvic health care for both our male and female demographic. What I find often happens is that a lot of people just don't know that this is an area of physiotherapy that some of us, or many of us, specialize in. And so a few things that are worth noting are specifically in our male population that there is a perceived loss of masculinity for those experiencing any sort of penile dysfunction. When it comes to any sort of infertility troubles, oftentimes 40% can be due to male-based reasons. So I think that's a stat that maybe prior to getting into the pelvic health realm, I maybe wouldn't have realized. Within our male demographic of patients, 45% of males have what's called small penis anxiety. Now, there's not much that we can do within physiotherapy to help that, but what I think is important to note that anatomy varies for everybody, and it's important to also note that this will contribute to one's mental health or may impact one's mental health. So it's worth kind of putting out that statistic to know that people are not alone. A few other things to note around mental health. So 1 in 8 men may experience depression and anxiety, and 80% of all suicides are men, which kind of equates to a 1 male per minute, which is a really drastic number. And so the more that we can discuss men's health and awareness around, whether it be pelvic health conditions or men's health in general, I think is always is helpful to let people know that they're not experiencing these things alone. And often, cases, there's many people experiencing it. So the more we chat about it, the more people tend to get help to deal with their symptoms and what they're experiencing. A few other things to note. So in a study done by Joe Milios in 2019, prostate cancer diagnosis and sort of the impact on quality of life. A lot of those patients reported feelings such as shame, shock and confusion, anger and fear, a perceived loss of masculinity, and then, as many of us can probably appreciate, increased stress, whether that be financial, career based stress or personal relations. So it's important to note that, health and one's health will always have an impact on quality of life as well. I've included a few pictures here around some of the foundations and cancer-based kind of initiatives for testicular cancer, prostate cancer, and then of course the Movember Foundation. We'll dive a little bit more into this at the end of our presentation this evening as well. And I'll provide some links so that if anybody's interested in reading more about those kind of individual organizations, you'll have an opportunity to check that out as well. So when it comes to male pelvic physiotherapy, it's important to note that males have a pelvic floor as well, right? So I think a lot of the language around pelvic health physiotherapy is geared or guided towards the female demographic. What's interesting is that we all have pelvises. Some of the anatomy will differ, but ultimately we have similar muscles providing support and stability to our lumbopelvic region. It just might look a little different, male versus female. So I won't dive in too specifically on muscles and ligaments, but it's important to note that yes, there is a pelvic floor in our male demographic as well. And lots of the conditions that we treat in our female demographic may be similar in our male demographic, and it comes down to kind of the anatomy that we're dealing with. So just a few slides and pictures there around particular anatomy when it comes to our pelvic floor. If anybody has really specific questions around this, we can always chat about that afterwards. A few things to note with respect to anatomy as well. So we have what's called fascia. That's kind of our meshwork of smooth muscle fibers, ligaments, blood vessels, connective tissue, right? So kind of like the saran wrap around everything, giving better leverage and biomechanical advantage to the muscles, joints, ligaments, tendons in our body. That's throughout everywhere, but certainly within our pelvic region as well. I like to talk about a little bone called the coccyx. So that's your tailbone. So you've got your sacrum. That's that triangle-shaped bone at the base of our low back. And then just at the kind of tip of that triangle is our tailbone, or coccyx. It's a really important joint there because we have so many ligamentous attachments, as well as pelvic floor muscles and our glute muscles that attach into that region. And so there's lots of people out there who are experiencing tailbone pain, and we're going to talk about that in more depth this evening. But really important to note that it's an important little joint at the base of our sacrum and pelvis there. A few other things to note about anatomy. So we of course have lots of nerve tissue. One that is kind of the star of the show a little bit is our pudendal nerve. It's both a motor and sensory nerve. So it arises from our S2 through S4 nerve roots in our sacral region. Motor and sensory meaning it does both, innervates muscles to contract and relax, but also has that sensation component to it. So when you touch or feel, right? Kind of as I've noted here in the slide, it's crucial for sensation and function in the pelvic region, including the genitals and anus, and then it's a part of our peripheral nervous system. So sometimes the pudendal nerve can be impacted. This can be through repetitive exercise like cycling, for instance. Sometimes patients will, express they've got pins and needles in their groin area. It might be the pudendal nerve implicated there. Other patients will have, other medical conditions that might contribute to symptoms, loss of motor or sensory symptoms through that area of the body as well. Last but not least, we kind of talked about pelvic floor muscle function, and then I've just listed a few of the muscles that are implicated there or impacted there, and we certainly will have many more, but just to give an idea of kind of what we're looking at. So our pelvic floor provides, and pelvic floor muscles provide a few different functions. Ones we like to talk about most is support, stability, a sphincteric function, sexual function, and what's called a sump pump function. So when it comes to support, we're obviously, aware that the bony structures, ligaments, fascia will provide support for our internal organs, the visceral tissue. Stability, it kind of fixates the trunk with our extremity movements, meaning that our trunk kind of rib cage to low abdominal region, and then our kind of limbs beyond that, right? So in this case, more of our hip and lower body movement. When it comes to sphincteric function, we're looking at sphincters within the body for urethra, anus, and then this obviously will provide, better bladder and bowel control. Sexual function, so contract, relax of musculature, erection, orgasm. That's, all the muscles within our pelvic floor is going to really help with sexual function there. And then lastly, what's called sump pump function. So this is kind of our circulatory system, right? So lymphatic fluid, driving that up. It's kind of like a hub for lymphatic drainage. We want to pump fluid from kind of lower extremity legs back up to the heart. And our pelvic region provides a nice kind of stopgap, if you will, to a midpoint for, getting our lymphatic drainage system working well. So let's talk a little bit about pelvic health physio and what is included in this. So this is just kind of a generic outline, and every patient will be different depending on their goals, their needs, and that sort of thing, what they've come in with. But we often will start with a subjective history. That's me asking you questions about what's brought you in today and what symptoms you're experiencing. What I find with pelvic health that's quite helpful is that we typically send paperwork off to our patients, not only for a medical history, to begin with, but also what we call a symptom monitor. So this breaks down bladder, bowel symptoms, sexual function, sexual activity, if people are okay and comfortable to discuss it. Certainly in our female population, we talk about pregnancies, labor and delivery, if it's appropriate for that patient. Male, symptom monitor, it's more about, symptoms, pain, and certainly when it comes to bladder and bowel function, as well as sexual function. Obviously, medical history, so certain surgeries, medical conditions, medications, really important to discuss that because sometimes those things can be implicating or impacting what's going on with bladder and bowel health, as well as erectile dysfunction. Then we get to what's called objective findings. So this is where typically I look through some range of motion, whether it's your low back, your hip. We do a bit of a screen to make sure nothing that way is causing or impacting any of the symptoms people are experiencing. The thing that's interesting and unique about pelvic health physiotherapy is that we have an opportunity to complete both internal and external treatment. So this is something that patients need to consent to, and we discuss in detail about what to expect with an internal treatment or assessment. This includes in our male demographic a rectal exam. And so it's all digital palpation, typically, lots of gel and gloves, of course, and typically one digit that we would use. And again, this is with patient consent. So it's not that we absolutely have to do this. It's a part of the, treatment and assessment that we can offer. and oftentimes is quite helpful in determining what is driving someone's symptoms. But patients, of course, always have the option of sticking to an external only approach, and then are able to decide if internal approach at some point is maybe helpful for them if they're not seeing the results that they may be after. Of course, we'll go through goals and home exercises, planning that way for, how to best support people when they're not in clinic. Oftentimes I'll see patients, a couple times a week. And so what we do outside of the clinic really will help drive how we feel when we see people in clinic, right? So really important that we know what people are expecting out of treatment, the goals they're looking to achieve, talking about realistic expectations around that. Addressing, maybe the activities or hobbies people have outside of, or work, related tasks that we can then discuss how to best manage symptoms related to, their physical activity and maybe work-related, tasks that way too. We typically will also talk about treatment planning. So, how often would I suggest, based on my experience and education, to see somebody? What does that look like? Keeping in mind people's schedules and finances as well. But certainly it's, to give our best kind of guidance around, what someone's experiencing and how this might impact them, and how often we should be seeing them for treatment. When it comes to treatment, this will vary depending on the patient, right? So it depends on their comfort level with internal versus external treatment. But typically what most pelvic health physiotherapists will do in a treatment session is some amount of soft tissue work, whether it's abdominal, through the low back, hips. This can also be done internally through pelvic floor muscles and digital palpation. We'll sometimes work on, mobility of both kind of rib cage, thoracic, that mid back, lumbar spine, low back, through hips, sacroiliac joint, and abdomen. As I mentioned here, some internal and or external pelvic floor muscle treatment techniques. So some soft tissue release that way with that digital palpation internally. Breathing techniques, so we can always, guide people. I can feel as someone takes a nice deep breath, are they getting some length and mobility through their pelvic floor, or are we really quite gripped and holding on to a lot of tension? So that's where internal comes in quite handy, in that I can give a little bit more feedback on what's going on with pelvic floor when you're breathing. We also, in treatment, will often have an exercise kind of based approach with strength and mobility rehab. So this may be, lumbopelvic core based strengthening and mobility. This may be something known as Kegels, right? Some people may have heard of Kegels. That's also an appropriate exercise for our male demographic. So this is essentially just a pelvic floor muscle contraction. So has the name Kegel, but you're basically contracting through those muscles of your pelvic floor. And there's a particular way to do that, but that's always kind of best to be done, in a treatment room with somebody who, treats pelvic health physio, because everyone's a little bit different this way. And some of the cueing we would use for this may change depending on the patient. So let's talk about a few pelvic health conditions. These are kind of just a brief overview of what we're going to discuss a little bit today. The point of this evening's, or kind of my goal with this evening's webinar, was just to provide people with some information around the different conditions that we see, what to expect with, pelvic physiotherapy, and how that might help somebody with their symptoms. And so I think, given that there's lots of people who are experiencing some of these things but don't necessarily realize that pelvic physiotherapy can be helpful, I thought kind of taking a more broad approach to a webinar this evening and covering a few things would be helpful versus just zoning in on one topic. So certainly, again, if anyone has questions after we're all finished, feel free to reach out to me in the chat, or we can always set up a time to talk at the clinic should that be of interest to someone. So first thing we're going to talk about is common conditions that are associated after a surgical procedure known as radical prostatectomy. This is when the prostate is removed due to cancer, right? So typically, what I see in clinic is people will then be referred for pelvic physiotherapy to address some of the symptoms they're experiencing post-surgically. Oftentimes, what we see is urinary incontinence and erectile dysfunction. Sometimes pain as well, but these two tend to be the most common. And so some of the stats and numbers around this. So 99% of patients experience urinary incontinence after a radical prostatectomy, both stress and urge incontinence. So stress incontinence is an increased stress on the bladder, abdomen, and it's a pressure management issue. And so you think about maybe having a little bit of dribbling, leakage from the bladder with a cough or a sneeze. That's a common one. Urge incontinence is when patients are experiencing that strong urge through their bladder that they need to urinate, maybe have a difficult time holding this and don't quite make it to the washroom. There are particular kind of parameters around how often we should be voiding our bladder, how many times a day, that sort of thing. We'll talk about that shortly as well. Another few things are post-void dribble, right? So sometimes we may not have that cough and sneeze leakage. We may not have that really strong urge, but we void our bladder and we still have this kind of dribble that may occur once we get up and away from the bathroom, walking on your feet. You might have a little bit of dribbling there, kind of post-radical prostatectomy. And then another common one is urinary leakage during intercourse. So again, that's kind of impacting quality of life. Certainly also something that is kind of a pressure management situation as well, and how we're managing our breathing and tension through pelvic floor. Another common condition post-radical prostatectomy is erectile dysfunction. So 68 to 99% of patients experience erectile dysfunction after radical prostatectomy, and 16% regain pre-op erectile function without any sort of penile rehab. We often will see patients post-op for this because, of course, this is impacting their quality of life. And so some of the treatment for these two conditions that we see, or symptoms that we see post prostatectomy, include some bladder training principles around urge delay, as well as timed voiding might be helpful for some. Fluid intake can play a role, bladder irritants as well. So discussing, some lifestyle changes and choices. Pelvic floor muscle strengthening is a really big one that we'll use post prostatectomy, and penile clamps are something that typically we have somebody, seek a diagnosis for this or a referral from their family doctor, and then we can discuss when to use it, how to use it, that sort of thing. Some other treatment options for people are incontinence pads, and then there is surgery for kind of the urinary sphincter as needed, and that's in cases where maybe patients haven't seen great results with physio after a prostatectomy. I would say, just in my experience, most see some amount of improvement, if not really great improvement, with some of this post kind of surgical symptoms they experience. So the next thing we're going to talk about is a condition called chronic pelvic pain syndrome. It has a couple of different names. So it also may be referred to as chronic non-bacterial prostatitis or persistent pelvic pain syndrome. Essentially, this just means you have pain in your pelvic region greater than 3 to 6 months, so more in that chronic phase. Anything past 3 to 6 months is considered chronic opposed to acute pain. In terms of some statistics around where this pain occurs, so oftentimes you'll get more than one location, but it can occur in the perineum, testicles, penile pain, or pubic pain, low kind of abdominal pain. And there's just some percentages on the likelihood of that for each of those. It typically is seen in men under the age of 50. But what we find is that average symptoms take upwards of 87 months before a diagnosis. So this is where, when we talk about men's health awareness, it's super important that men are speaking up for themselves when they meet with their family doctors. Certainly, physiotherapy when that's available, to you. If you have time and finances, that's helpful. We typically, at least in Ontario, don't need a referral from a doctor to see patients for some of these conditions. And so if that's something that, while I always encourage people to, update their doctors on these things, you can always just come to physio without a referral, in Ontario at least. So really important. That's a long time for somebody to be experiencing some amount of pain and dysfunction. Oftentimes what we see with kind of this chronic pelvic pain is there's other, symptoms, including increased urinary frequency. Maybe there's pins and needles implicating that kind of pudendal nerve area. Oftentimes some erectile changes, so decreased morning erections, weaker erections, ejaculatory pain, as well as even sometimes just weaker ejaculation as well, right? So lots of different symptoms that can be occurring with this type of syndrome or condition. It's important to note this is a non-life-threatening, non-cancerous condition. So even though it says prostatitis, it's not something that is usually a concern for the prostate specifically. Oftentimes what's great is if people have seen their doctor already and they've ruled out through whether it's a PSA test, some blood work, that we're not concerned about any prostate cancer, testicular cancer in this case, and it really is more of a pain syndrome, okay? And then when we talk about physiotherapy treatment with this, we often are going to focus on relaxation of muscles prior to any sort of strengthening. So really important that we get good balance between mobility and tension under control. That's hopefully not painful. Sometimes at first we can have that pain on digital palpation, in which case it's really important that we settle the tension, graded exposure to internal treatment if people consent to that, in order to settle that sensitized tissue or that painful tissue. And then once that's a little more settled, we tend to focus on building up strength. So that will be through pelvic floor muscles, that'll be through our lumbopelvic region. So we will work on glute strengthening, core strengthening, increased tolerance to activities, so progressive overload to activities that might be symptomatic or painful. Really important that we go kind of at a good, graded exposure pace, opposed to going 0 to 100 with this type of thing. And, making sure that we get good mobility before we then build on strength. So next we're going to talk about a condition known as coccydynia. This is tailbone pain. So as we were mentioning earlier in the presentation, it's that sort of area. I think if I show you here, hopefully you can see the cursor. This is kind of a nice, so it's in this area at the base of the sacrum. But what's interesting, I like this photo at the bottom here because it's really interesting to note that how we sit sometimes can play a role in how this feels. So when we're sat a little bit more on our sits bones, these ischial tuberosities, it really takes the pressure off our coccyx, which can be more comfortable for people. When we're sitting in more of that slouched kind of posture, we tend to be in this more kind of, swooped, posterior pelvic tilt position that can put a lot of pressure on that tailbone area, which can lead to pain over time. Now, there's multiple reasons why someone might have coccydynia or tailbone pain, but I just liked this this image to show people so that you can kind of see the area that we're talking about. So this can sometimes be classified in that kind of chronic persistent pain syndrome because in my experience, I've seen quite a few people who have had this a really long time, right? It's one of those things where maybe it comes on, it's there and it's not there, kind of comes and goes, that intermittent pain, but over time it has lasted for them, opposed to it being a very acute, 6-week injury that then resolves. I do find that there's a lot of patients that have this ongoing, so we can kind of classify it almost under that chronic persistent pain. It can be caused by a mechanism of injury. So if patients note that they had a fall recently and landed right on their tailbone region, right? Some will make sure that they've had an x-ray to rule out any sort of fracture, right? But then that pain persists long term. So fall down the stairs or something, right? And then there's lots of people who don't have that sort of mechanism of injury. It's just sort of this came on over time, not really sure why type of pain, often aggravated by prolonged sitting positions. It also will be dependent sometimes on the surface that people are sitting on. So, at a restaurant on a bar stool, for instance, might not be the most comfortable versus maybe their couch at home, for instance. Kind of coming back to the treatment portion and how we would deal with something like this. So again, it comes back to relaxation of pelvic floor muscles. What I often find with patients experiencing this tailbone pain is they're carrying a lot of tension through pelvic floor muscles. And so that's something that we really like to work on through breathing. Maybe it's internal treatment that we do some soft tissue release. Maybe it's external and through mobility work, stretches, that sort of thing, that we can, relieve some of the tension of pelvic floor muscles. A couple of things that are really important are activity modification and postural changes, right? So modifying what we're doing in our day-to-day can be really helpful. Sometimes some of the sustained postures, so those maybe that are working from home have less opportunity to get up and move around through their day now that they're just kind of sat at their desk and everything they need is within like a 5-foot radius. Really important that we encourage those postural changes, people getting up. Maybe it's a sit to stand desk, maybe it's just getting away to grab a glass of water. Really important that we modify activity and our posture to help alleviate symptoms that way. Strengthening of lumbopelvic musculature, right? So again, we come back to core, low back, pelvic floor, hips. And so this tends to be something that we work on once tension is a little more resolved. And certainly if there's pain on palpation, we tend to internally specifically, we tend to, strengthen once, tension and pain on palpation are resolved. A few other things to note is addressing what we call psychosocial factors. So this is, in physiotherapy, we really try to, and certainly with my colleagues here at EPA, we really try to drive home what's called a biopsychosocial approach. So the bio portion of that is kind of the biological condition itself. So that's your tension of muscles. Are they strong? How are joints moving? That sort of thing. Whereas the psychosocial factors are, what's impacting our mental health, what's kind of our day-to-day look like, those social factors around work and play, right? What do people get up to in their time? And so while it's not our role to dive too much into, therapy or anything that way, not within our scope, it is important that we address that some of these lifestyle considerations, maybe it's stress management, maybe it's sleep habits, within reason, bringing to light people's, nutritional choices and things like that, hydration. While, I like to make mention to people that, go speak to your family doctor, speak to a nutritionist for specifics, but noting that some of, what we do in our day-to-day will also implicate, more of these chronic pain conditions. And then we're going to talk a little bit about a condition called overactive bladder syndrome, typically shortened to OAB in documentation and things like that. And this is simply the frequent and sudden urge to urinate that may be difficult to control for some. So there are two kind of different versions of this. We have overactive bladder, dry versus wet. So there may be patients experiencing this kind of frequent and sudden urge to urinate, but don't have any leakage associated with this. There will also be people who have the frequent and sudden urge to urinate, difficult to control, and may also experience leakage. So that's more of your urge incontinence. And so that kind of goes to that second point there, where people may experience that unintentional loss of urine after an urgent need to urinate, right? What we consider to be normal bladder function is voiding our bladder every 2 to 3 hours. So that tends to be kind of 5 to 8 times a day, depending on your fluid intake, your activity throughout the day. What you're drinking will also, impact this, but kind of every 2 to 3 hours is what should be fairly normal and reasonable for people. And we typically should be able to hold overnight as well, barring, down in a whole glass of water right before bed. But once per night is fairly normal if you're over the age of 55. And then, of course, there's going to be some medical conditions that will also have people a little more thirsty, drinking more, urinating more often, and maybe at nighttime as well. So everybody's a little different this way, but that's kind of your generic guidelines for how often we should be voiding our bladder. If people are finding they're, voiding kind of around this, but a really strong urge to go, that's one thing. Then oftentimes you'll also see that patients are experiencing that increased urge and frequency. So they're heading to the bathroom more often, and it's very urgent for them to go. When it comes to treatment, lifestyle education and habit changes are really important here. So we will discuss, with patients, bladder irritants, meaning, how much coffee, tea, carbonated beverage are they consuming? What does alcohol intake look like? Knowing that all of that will really impact that bladder lining and cause a stronger urge to urinate. I would also say if people are not drinking enough water, so maybe it's not so much the coffee, the tea, the carbonated beverage, it's more that they just really aren't drinking a ton throughout the day of fresh, flat water. And when we are more dehydrated, our urine becomes more concentrated and will irritate the bladder lining. So patients who are experiencing that sort of urge incontinence, that loss of urine, often will dial back their fluid intake, hoping that it helps. And it typically has the opposite effect, because now we're a little more dehydrated and that bladder lining gets really irritated from that alone. Okay, so the lifestyle habits, education around changes this way is really helpful. Urge delay techniques. So there's lots of things that we can focus on in order to help people work their way through the urge they might be experiencing. So some common ones tend to be just using some deep breathing, as well as focusing on something else, right? Distraction is a great technique just to, completely take your mind away from the fact, you peed 30 minutes ago and you gotta pee again. Let's just distract you, right? So sensory distraction, actual physical distraction, get up and go do something can be helpful. A few other things that we can work on for men experiencing an overactive bladder is timed voiding. So sometimes I find people like to have a schedule with this. And so if we kind of work out, like, at this time, you're going to void now, and then this, and then this, and then this time, that can be quite helpful. Bladder retraining has to do with sometimes fluid overload, and your system just has to work through some of those, that increased fluid intake, and you work on those urge delay techniques. So there's some kind of techniques we can do with bladder retraining as well. Last few things that we typically will do treatment-wise is soft tissue techniques for the abdominal region, pelvic floor muscles, and again, the strengthening, right, that we kind of have come back to a few times with some of these conditions. So you're probably noticing a few themes with this, that, we're often, wanting to address tension, address pain, through pelvic floor muscles and then strengthen once that's a little more resolved. I should say medication, just for this last one, medication is also something. It's not within a physio scope to discuss in detail, but sometimes patients will find a tandem approach of medication prescribed by their doctor for overactive bladder, as well as the pelvic physio can be quite helpful, especially for those that are, urinating maybe 15, 20 times a day, and then maybe all throughout the night, right? Because if you are up 5, 10 times in the night to urinate, you are most definitely not getting the sleep you need. And so really important to work alongside family doctor with this sort of thing as well, just to help take that tandem approach if needed. Last thing we're going to talk about here before we get into a few exercises is erectile dysfunction. So this is really the inability to achieve and maintain an erection. So sometimes patients may be able to achieve it, but they can't really maintain it. It may be weaker, right? That's considered erectile dysfunction as well, opposed to complete impotence, right? Oftentimes, a holistic kind of tandem approach is important with this too, because it can be due to medical conditions. It can be a good indicator of someone's overall health. So there's a whole host of medical conditions that can contribute to this, but heart disease, high blood pressure, high cholesterol levels are common ones. And so sometimes that can actually be a good indicator of how someone's cardiac health is, and a good opportunity to recognize when it's important to maybe seek medical attention from your doctor around some of this if anyone's experiencing erectile dysfunction. Also can occur following surgery, right? So as we mentioned in that radical prostatectomy, prostate's removed, of course. I think most surgeons make an effort to spare the nerves, but in some instances there may be some nerve damage and nerve tissue that needs to heal, and so sometimes that can cause erectile dysfunction. And then of course lifestyle factors. So there's all sorts, again, a whole host of lists of things that will contribute, but smokers, alcoholic intake will contribute, sort of nutrition and activity levels as well. So those that are more sedentary, not as active, will be at higher risk for erectile dysfunction. And as I've mentioned here, really important to work alongside your family doctor to rule out and or manage any associated medical conditions, because it can be a few things that can contribute to this. When it comes to pelvic physio and how things can be helpful on our side of things, sometimes reducing tension through pelvic floor can be helpful. Increased blood flow to the pelvic region is really good. Increasing strength and endurance of pelvic floor muscles can actually really help, especially when it comes to maintaining the erection. And sort of that, if patients are experiencing weaker ejaculation, sometimes increased pelvic floor muscle strength and endurance can be helpful there too. And then also some education surrounding lifestyle factors, some of which we kind of chatted about already. And then just encouraging people to increase their physical activity, especially if it's on the lower end, right? So, increased physical activity increases blood flow, cardiac output, so that in turn can have a nice effect on those experiencing erectile dysfunction. So this is just, I threw a couple of pictures on here of some of the common exercises I give patients. Of course, dependent on someone's symptoms, the condition they've come in with, what their goals are, what their day-to-day social factors look like, how much time they have to contribute to a little bit of a home program, is all going to be dependent on the individual. And so there's no kind of recipe card for this. It does depend on each individual male that comes into the clinic and that I see. But a lot of the, kind of driving home the point, a lot of the exercises we focus on in pelvic physiotherapy, kind of that tandem approach of relaxation of muscles and tension through stretching and mobility work. And then we build on strength and endurance and increased tolerance to activities and progressive overload with strengthening, right? So some really common ones we start with are some nice hip stretches. So here we've got a bit of a what's called a figure 4. This is a piriformis and pelvic floor muscle stretch that most people quite like. We've got what's called a child's pose. So this is a yoga-based mobility exercise or stretch that people can either kind of work in and out of or just hold as a static stretch. That tends to be quite nice for both hip pain, low back discomfort and tension, as well as that kind of coccydynia, that tailbone pain. That's kind of a nice option. We will focus this picture. It looks like someone's just chilling, laying down, but really it's a demonstration of just some deep breathing, right? So what we call diaphragmatic breathing. This is different than, kind of our day-to-day breathing we do as we go throughout our day. So oftentimes we tend to be more chest breathers. And so what we focus on in pelvic physiotherapy is not only drawing that breath down to kind of rib cage, low abdomen, but what I like to call 360-degree breathing. So getting rib cage to expand, drawing that breath down to pelvic floor, lower down, allowing things to just be soft and relaxed. So diaphragmatic breathing, 360-degree breathing is really important, and it helps manage that tension, relaxation side of things through pelvic floor. And then we also will often dive into the strengthening side of things, right? So this lower picture here is demonstrating what's called, it's kind of like a modified dead bug, I guess, because there's no arm involvement, but sort of leg lowers, alternating leg lowers. Here we've got somebody doing a squat with a med ball that's got some weight to it with an overhead press. So focusing on, what is pelvic floor doing? What is abdominal region doing? Are we managing our pressure? And as we do these types of strengthening exercises, are we getting any sort of symptoms? So are we getting pain through low back, through coccyx, tailbone? Are we getting testicular perineal pain? Do we get symptoms like leakage, right? So if we're not managing our pressure and our breathing mechanics very well as we do these exercises, do we get some amount of leakage through that? So this is something that I typically start more relaxation-based, stretching-based, and then move into the strengthening as we go. And that, again, is a progressive kind of overload principle where we start low and slow and build, as things are appropriate to do so. And again, this is particular to each individual. Last little bit here. So we're done chatting about conditions, but now I just wanted to highlight a few resources, and there's many, many out there. I could have put 10 slides together on this, but a few that are great for men's health in particular that I really, really like, and I kind of flag for patients that I see in clinic. The Movember Foundation is fantastic, right? So I think this time of year, lots of people are focused on the Movember kind of raising money for men's health, which is great. What's fantastic is, their goal is to raise awareness around prostate cancer, testicular cancer, as well as men's mental health. So a nice, well-rounded approach through that foundation. The link is there for you. Just put it into Google. It's easy enough to find. Certainly when it comes to other cancers, so prostate cancer, testicular cancer, and otherwise, Canadian Cancer Society is a fantastic resource. It breaks down all different types of cancer, all sorts of resources on how to best manage treatment options, and ways to get support should you need it. And then another one I came across in some of my research for tonight's webinar was something called the Canadian Men's Health Foundation. So a little bit similar to Movember in this case, in that really their goal is just to provide more awareness around men's health and encourage men to speak up for the symptoms, for themselves and for the symptoms they may be experiencing, and to go seek help. There's no shame in that, and it's certainly what can not only make people feel their best, but also maybe save their life depending on what's going on. So just a few resources there that you can check out that I think are awesome, and lots of information. And that's it. So thanks so much for listening. If anyone has any questions or comments, feel free to pop it into the chat. I'll hang around for a few minutes more. you're most welcome to, unmute yourself if you're happy to kind of share a question for others. Just keep in mind others will hear. Additionally, if you have any questions, concerns, you're interested in pelvic health, whether it's for yourself or a loved one, feel free to give our clinic a call. I work here at our Bullfrog location in Guelph, but many of our Hermosa Physio locations will offer male pelvic health. And so giving a call to any of our clinics can certainly, our great admin staff can, hook you up with the appropriate healthcare practitioner and physiotherapist that can answer any questions that you might have for yourself in a more private matter, should that be the case. So I'll hang here, and if anybody has any questions, then feel free to fire away. If not, thanks so much. And I think the other thing to note is the recording will be available. So if there's, you're wanting to come back to it or share it with a loved one, feel free to ask, and we can get it sorted for you. I'm just going to take a sip of water. Otherwise, yeah, if there's no questions, people are free to leave and carry on with their evening. Oh, you're most welcome, guys. No worries. I hope you found it helpful. We'll be doing more of these webinars as we go, and specific topics, but today I wanted to make it a goal just to kind of give a broad overview. Okay, so a couple people still hanging out, but no messages in the chat from what I can see. So I think we'll call it a night. Thanks again, everyone, for joining. And then, as I mentioned, any questions, concerns, comments, feel free to reach out to our clinics. Have a good evening.